Welcome to this episode of MoveMint Medicine podcast. Thank you for joining us again today. We really hope that you've enjoyed the previous episodes. Please remember to subscribe to the YouTube channel and share and like the video. Please remember to share with your friends, family and colleagues, and also engage with the content. So please add any comments, any feedback, any questions that you might have, and we'll try and address that on future podcasts. So we thank our partners, so the Fit India movement, the Back to Fitness Clinic, which is the clinic that Rajat runs, La Ultra the High, which is the race that Rajat puts together in Ladakh, and also the Moving Mountains Within Film, which is the film about the 10th edition of La Ultra the High. So I'll hand over to Rajat, who will introduce today's special guest.
Thank you, Darren, and thank you everyone for watching MoveMint Medicine podcast. And today we have a special guest, Dr. Deepak Chaudhary. He's been at the forefront of sports medicine in India. So while the Commonwealth Games were on, and I'll let Sir talk about it. So welcome on board, Sir.
Thanks, Rajat and Darren.
So, Sir, please take us through your, professional and academic journey so far, please.
Yeah, Rajat. As far as my profession is concerned, I did my MBBS from University College of Medical Sciences, Delhi. I joined in the year 1979 and passed out in 1983. And subsequently to that, I did my MS Orthopedics from 86 to 88. And then joined Safdarjung Hospital itself as a senior resident and then as a medical officer. I joined the specialist cadre of the Central Health Services in 1995, where I was specially sent to Safdarjung Hospital, or rather posted to Safdarjung Hospital to develop this specialty of arthroscopy and sports medicine in the country. And so it was that was the year when it was starting, and we started from a very small clinic where we had no staff at all, and gradually we started upgrading to eight people in our team, then 16, and then as the number of patients started increasing, the government kept on supporting us, and from a small clinic we became a department, and ultimately it ended in a expansion to a full-fledged sports injury center in the year 2010 at the time of commencement of the Commonwealth Games. And during that period of from 2010 to 2018, when I was there, we performed close to about 15,000 surgeries, mainly connected with the knee and shoulder reconstruction of the ligaments. Plus, we had a big backup of rehab and sports medicine people. We had sports medicine experts from the army to assist us. They came on deputation to be posted with us. And we were the first in the country to start the MD sports medicine as well as the fellowship in arthroscopy and sports medicine. That is as far as my professional career goes. Now, I have joined as director of the Dr. B.L. Kapoor Hospital at Pusa Road.
Fantastic. Thanks for that fabulous introduction. I just wonder whether you could tell us a little bit about your personal sports and exercise journey. So have you always been very active?
Yeah. Since my childhood days, in my school days, I was a bit on the stocky side, and my father, just to get my weight in the correct proportion, introduced me to badminton. And since then, gradually, I started playing better and better, and then I represented my school at the All India Championship. We won a lot of championships at the school level, and then ultimately I became in the junior category, I became the Delhi state champion as well a couple of times. I captained the Delhi state team as well as the Delhi University team. We won a couple of championships at the All India level in the inter-university also. And once I joined my medicine, there were a lot of competitions at the All India intermedical level. Again, I won that tournament a couple of times, the All India Intermedical Badminton Championship. So this continued till about 2002, 2003. I continued to play active badminton. But then we shifted our residence, and then here in SDA, and then I couldn't find a suitable partner for my badminton. It is at that point of time, I was already used to running about 5 to 7 kilometers as part of my badminton training, but nothing serious about running. but gradually I started picking up more and more of running. And in 2008, I ran my first half marathon, and with great difficulty, I could just complete the run in 2 hours of 40 minutes. But then that was just the beginning of my running career. And each year I started improving, right from 2 hours 40 minutes to my latest timing has been less than 1:45. And similarly, the full marathon I started in 2010, and then I have run since then close to about 8 full marathons. Again, from a timing of about 4:40, I have the last 3 full marathons I have done in sub 4, and which only proves that age is just a number. So that is my journey as far as my career in badminton and running goes.
So that's an interesting point. No, I mean, those are wonderful times. You know, the time that you have for a half and a full marathon. But most of our colleagues have been saying that, you know, running causes knee arthritis and don't run anymore because, you know, it'll cause knee pain and whatever. What do you have to say about that, sir? And being in orthopedics yourself.
Yeah, Rajat, I think this is just a misconception. Recreational running just improves bones to your muscles, and it really helps in toning up of your whole body rather. And yes, in cases the patient has got some mechanical injury, maybe a meniscal injury, ligament injury, for a limited period of time till that is taken care of, one might have to avoid running, but even then one can, you know, change your activity level to non-impact activities like cycling, swimming. So it's a completely misconception that running will spoil your knee. That is what I have to say on that.
So you clearly have a sportsman mentality. How has that changed your practice, and is that different to any of your colleagues?
Yeah, Darren, once I am into this profession, actually I took this profession only because I was myself a sportsman, and so I had a great interest in treatment of sports injuries. So once I took MS orthopedics, it was always my dream to specialize further in sports injuries, and the best way as an orthopedic surgeon, what I could do was to specialize myself in arthroscopic treatment of knee and shoulder injuries, for which our sportsmen used to go abroad. So most of the injuries that we face is the injuries in the knee, like ACL injuries, which is very, very common, and the meniscal injuries. And people used to think that once they get an ACL injury, their professional career is almost finished. But the type of ACL surgery that we do in our country, I think we are second to none, and we do have some very robust, I would say, rehab mechanism. We first of all long fixations with various materials so that we get a very strong construct, so that we can put the patient on a early range of motion. And the rehab also proceeds quite fast, in the sense that our patients of ACL, they return to cycling, swimming in the 3rd to 4th week. And so that patient gets a feel-good factor that they will ultimately go back to their pre-injury level at the earliest. And we have some documented athletes who, after their injuries to the knee as well as to the shoulder, where rotator cuff injuries and recurrent dislocations are very common, they have gone back to their pre-injury level and even won medals for their respective states and even for the country. And this gives us immense satisfaction, because injury per se should not, spoil the career of an athlete. And every athlete is worried that when I would be able to return back to my active sports. And so as a surgeon, we can just do the good surgical part, but then it's always a teamwork, and then the sports medicine doctor, the rehab doctor takes over and devise protocols so that each and every patient can go back to his or her pre-injury level at the earliest. Now, the impact which this has on the patient is being myself from a sports background, I can always motivate them that this injury you will be able to overcome and go back to your active profession. And coming back to my colleagues, I have always, as a team leader, inspired them to, take this sports and running very, very seriously and, actively. And I'm very glad and rather proud to say that many of my colleagues have taken my example, and, they have also participated in various half and full marathons. And greatest impact that this has on the whole, always feel that it is the sportsman who, it is the mind which makes things how you think. That is where you lead your life, and I happy and proud that way I am able to inspire my whole team as well as my patients.
That's wonderful, sir. Motivating others is the best thing, right, sir? But there aren't enough yet, sir, like in our fraternity. There are not enough doctors who probably are not in touch with maybe you and me. How do we change that? Do we start with the college? Do we start where they work? I mean, what do we do for that?
Actually, Rajat, whenever I speak any guest lecture in any conference and I am invited, I always put my slide of my latest timings there as the last slide, and on my own I try to motivate. And you will be very surprised that it is not only my own team, but all over India I get feedbacks that sir, we have been also started doing half marathons and even full marathon, and this gives me immense pleasure that I am able to motivate. So it is like platforms like this when I try to motivate my colleagues who are in other parts of the country as well, not only as part of my team, but also in other parts of the country, to motivate them to run. And Rajat, you being in the same field, you will realize that how proud and happy you feel when your running group keeps on increasing exponentially. And I think this awareness of running is gradually catching up, and more people are turning to running, because running, as you know, apart from the physical benefits, the mental benefits that it has immense, and I think you can vouch for that.
That's fantastic. Thank you, sir. So we touched on one of the misconceptions about running earlier, that it can cause knee pain and osteoarthritis. Are there any other common misconceptions within your field that you'd like to discuss?
Yeah, again, a lot of patients who come to us with knee injury, especially an ACL tear, they feel that this is the end of the career. And as I said earlier, I motivate them that ACL is an injury which is we can reconstruct the ligament, and it will be within just a matter of few months, not more than 6 months, that they will go back to their active profession. And we make it happen, and we, introduce them to other people, other patients who have already gone back to their pre-injury level, make them talk to them to motivate them. And then this is a very common myth with which patients come from far off regions, especially the wrestlers and the kabaddi players from far off areas. They come that we are having ACL injury now, our career is finished. And when we introduce them to the other patients who have recovered and gone back, they feel very good. Similarly, another misconception is that during the acute phase, many patients, they resort to hot fomentation. So it is always, I tell them that the ice which you should apply in the initial phase, because that is the thing which will reduce your swelling. And another misconception is that many people, they feel that the more you exercise, the better. Even in the presence of injury, if you exercise more, it will be better. Now, the pain is an indicator that you have to stop. It doesn't mean you have to stop all your activities. It means that that particular portion which is injured to be rested in a way, and you can continue with exercises of the other area, but always remain in a pain-free zone. So these are some of the common mistakes with which our patients come, and one has to counsel them on these issues.
Thank you, sir. So what about advice for patients and connecting it with their exercise, with the pain and the injuries that are happening? So what would you want to say to either sportsmen who are not yet injured, Or if they're injured, how big a role does physical activity play to get them back sooner?
So as I said, the rehab is a very important part of the injury management, whether you do it by surgical management or by non-surgical management. And once you are doing exercise, it is not that you have to do only aerobic. You have to, it's a combination of aerobic exercise. It's a combination of strengthening, it's a combination of mobility. Plus, you also need to have a good hydration as well as a good diet. So all these become a part of the sports medicine, and we have with us the dietitians, the psychologists, the sports medicine people who are there to guide on all these issues, because it is not that if we just do the surgery and the patient will be all right. It has to be an exercise program, and the exercise program has to be tailored to that particular patient, and no two patients can have a similar motivation level. So all these factors, it's a combination of all these factors which come into play when you have to advise the patient regarding the exercises, especially with relation to injury management.
So currently, obviously, half of the world is in a situation of lockdown courtesy of the coronavirus. Is there any recommendations that you'd give to people to stay active in their homes?
Yeah, it's a very tough times, and I can understand like people who run outside. It's such a punishment for them to stay indoors, and it is becoming so very difficult. But then one always has to tune your mind to that particular situation. And for that, like I myself have some space in my house where I do some exercises which are a combination of aerobic, in which you can do on the spot jogging, high knees, running, back and jumping jacks, burpees. These are all basically aerobic exercises, combination of aerobics and some strengthening. If you have some weights, it's all right. Otherwise, some dynamic strengthening exercises. And plus the mobility, I think yoga, which I had left some time back, it has again come back into my practice because of this lockdown. So each individual, according to his or her resources, they have to find space and time. Time is plenty, and I think they have to find out a way. There are online classes also going on. You can subscribe to them. So there are various ways to stay active and maintain your fitness level also in the present grim situation. Yeah.
So, and anything else that maybe we missed out and you want to talk about?
Rajat, I think we have covered everything, but the only thing message which I would like to give is that in my younger days, I was not a very, very, very lethargic person, and not very, good in studies also. But this activity has changed the whole way. I topped my 12th class. I stood very good in my MBBS exam. As you can see, I progressed in my marathon running as far as time is concerned. So it's all a matter of thinking. What the mind can think, the body can achieve. This is, I think, the ultimate message which I want to give to everyone, that you should always think positive, and only positive things positive outcomes will emerge out of it, and you'll feel stronger, both physically as well as mentally.
Fantastic. Well, thanks very much for joining us today, sir. I think they're really important messages, not just in terms of sort of our own health and well-being, for our professional activity as well.
Thank you, Rajat. Thank you, Darren. Thank you for taking me on board.
Thank you. We'll bring this episode of MoveMint Medicine podcast to a close, and thank you very much for listening.